Good afternoon. Thank you for joining us today. I'm Jason Zacher, the Senior Vice President of Business Advocacy here at the Greenville Chamber. Over the past 2 years, we've hosted these Community Matters discussions to connect you with local, state, and national leaders on topics of relevance to you and your business. We're pleased today to bring you this special edition of Community Matters regarding the Biden administration's vaccine mandate for private employers. This plan certainly comes with no shortage of controversy, but we're not here today to debate the merits of the plan. We're here to provide you with the information you need to ensure you understand what actions you may need to take to keep you in compliance. And given the level of concern with this OHSA action, we are pleased to bring you today's webinar. So quickly, some housekeeping notes. All attendees should be on mute with your cameras turned off. You can submit questions through the chat and we will work to get them answered after the presentation. So we are pleased today to have with us Ashley Cuttino, a shareholder with Ogletree Deakins. I won't go into her full bio again as I did because she just started this. She was with us about a month and a half ago. But Ashley's led Ogletree Deakins' nationwide unemployment response team, where she tracks unemployment changes nationwide and provides counsel to clients on unemployment-related issues. She's also the co-chair of the Ogletree COVID-19 Litigation Practice Group, which includes all areas of employment law, as well as personal injury claims. In this role, she's been able to exercise all of her diverse legal and trial experience, which would take me another 20 minutes to go through if I were to do that. Outside of COVID-19, Ashley concentrates her practice on management side employment litigation, including defending claims against wage and hour discrimination, wrongful discharge, and breach of contract suits. Ashley's specialty is complex litigation and class actions. In addition to this work, Ashley is very engaged with the chamber. And as we were talking about before we started, we usually find her on some soccer field in South Carolina most weekends. I was looking for her this weekend by checking someone watching a soccer game with a laptop on her lap. So with that, Ashley, we're glad to have you back today. And I will turn it over to you to provide us with an update on this action.
Thank you, Jason. So guys, please feel free to put questions in the chat. We only have a limited amount of time today, but I'm going to try and give you at least the basics of what's happening and what's going on so that you'll know what questions you need to ask yourselves and your companies and really what the next steps are that need to be taken. So the first thing I want everybody to realize is that we actually have 4 pending rules like the ETS we're talking about today. So there's one that's specific to healthcare. It is expiring in December. They issued a new one that basically covers most people that receive Medicare and Medicaid. Then there is a third one that covers people who have federal contracts. And then there is a fourth one. The fourth one is what we're talking about today. It is an OHSA ETS, and it covers everybody, private and public employers in South Carolina that have more than 100 employees. Now, it's important to note that as a company, you might be covered by more than one of these rules, but no employee will be covered by more than one rule. So you could have federal contracts and be covered by the federal contract rule, and then have some employees that are not covered by that rule, then they would be caught in this 100 employee OHSA rule that we're going to talk about today. So just be cognizant of that if you may fall into multiples of these buckets. So let me tell you what's going on and what happened. So Thursday of last week, President Biden and OHSA announced that this rule was going to come out. They issued on OHSA's website a great 30-minute video. I encourage all of you to go watch it. There's also a really fantastic FAQ section that's on the OHSA website that answers lots and lots of questions. And they released the rule. Then on Friday, they put the rule in what we call the Federal Register. That's when it really became an official rule and something that was live and active. Immediately after that happened, we had a multitude of states sue to try and stop the rule. On Saturday morning, we woke up and the Fifth Circuit had issued a temporary stay of the rule. Now, I will say a lot was made of the temporary stay. Here's what I'm going to tell you about the temporary stay. It's just temporary. It actually only lasts for this week. So it doesn't impact any of the deadlines that we're going to talk about right now. It could impact them later, but not right now. What is going to happen, and you're going to hear a lot about this in the news, I just don't want you to get lost in it. Different attorney generals filed these lawsuits in different states, in different appellate courts. They did that on purpose to spread out their chances of winning. Now what is going to happen is the courts are going to consolidate all of those different cases into one piece of multi-district jurisdiction. And they're going to pick one of those courts of appeals to make a ruling on it. We may have that court, whichever court they pick, it's going to be a lottery that's going to happen in 10 days, may issue a new stay that will make these deadlines we're going to talk about not apply yet. It would be a hold. We don't know if that's going to happen yet or not. So right now it stayed, but we're going to have to wait on another court to issue an official stay for it to really change these deadlines. But ultimately, none of that's going to matter either, because the Supreme Court is going to review this rule. And the Supreme Court is really going to be the one to tell us if it is valid or if it is not valid. And it is still up in the air how long it's going to take for them to move through the court process. You do start at the level right under the Supreme Court, though. So there's only one more step to take. It'll really depend on how fast these judges move. I will tell you that they are moving fast. So the Fifth Circuit that we talked about, they actually, so the briefs were filed on Friday. The court issued the stay on Saturday. And one of the answers from the government was due yesterday. And now the states have to have their replies in tomorrow. So that's about as fast as you can make lawyers move, and they are pushing them to move really quickly. So we're going to have answers sooner rather than later, but not this week, not next week, or, it's going to be a couple of weeks before we really see what happens with this thing. But here's what I want you to really hear me say, and we're going to talk about the details of this thing, but you have some choices here, but all of the choices that you have as an employer are going to take preparation and time. And you don't want to be too far behind the 8 ball that if the ETS survives the challenges, that now you're really behind in what you're going to do and what you have to do. So again, the ETS is an emergency temporary standard. Basically what OHSA decided was that unvaccinated workers in our workforce pose a grave danger. And because they made this grave danger finding, they now can issue the ETS. So who does the ETS apply to? Which of you guys should care? So it is any employer that has 100 or more employees during the pendency of the ETS. So if you have 100 employees today, you're covered. If you have 95 employees in February because you let some people go, doesn't matter. You're covered because you were covered at one point. If you only have 75 today, but in January, you hire 30, you're going to be covered as of the day you get over that 100-person limit. So as soon as you have 100, you're going to be covered. So what about who you count in the 100? So if they're on your payroll, you count them. If they're a part-time worker, you count them. If they're a remote worker, you count them. If they're a temporary worker that you hire, you count them. If you're using a staffing agency, they go under the staffing agency's count, not yours. If you're part of a franchise or franchisor relationship, we have to look at it and see. It depends on how independent you are. If you're truly independent in that kind of franchise relationship, it'll be an individual count. If you have, you're part of a larger company and you've got multiple operations all together, it really depends on how your safety operations work as to whether or not you count together or you count separately. Again, all of that's covered in the FAQs, but your first question is, do you employ 100 or more folks? And if that answer is yes, you're going to be covered by this thing. All right, so once you decide that you're covered, then what do you have to do? So a lot of people in the news talk about the ETS as a vaccine mandate. That's kind of true, but kind of not true. So OHSA has given you two options. The first option is a vaccine mandate. So you can mandate vaccines in your workforce. You have to have medical and religious accommodations that you process in the normal fashion. And then you're compliant with a few other things we're going to talk about. Or if you don't want to have a vaccine mandate in your workplace, you go to option 2. Option 2 says that you can allow workers to be vaccinated, or they can test for COVID-19 on a weekly basis and wear a mask. Not or a mask, and a mask. So you could be vaccinated, weekly test and wear a mask, or you can just put a vaccine policy in place. But there are also some other things that you have to do regardless of which of those decisions you make. So after you decide which decision you're going to make, there are a couple of other things you have to do. The other things you have to do are you have to have a written policy outlining which choice that you've made. You also have to provide anyone who chooses to go get vaccinated with 4 hours of paid time off per vaccine. So it's 4 hours one time if you get J&J, but you get the 4 hours for each vaccination if you get Moderna or Pfizer. You also have to, and that's a new bucket of leave. You don't use your existing PTO. You also have to allow people to take PTO if they get sick after a vaccination, but that can be taken from an existing PTO bucket. But you have to explain all of this to your employees in your policy. You also have to make sure your policy says that if anybody gets sick with COVID, they're going to be out of the workplace during a quarantine. And you have to report to OHSA if you have a workplace related COVID exposure that results in hospitalization or fatality. That was already in existence anyway. But the other big thing that you have to do, and this is what I would tell everybody on this call should be the number one thing you do and the first thing you do. You have to create a roster of all of your employees. So everybody that you're counting to get to your 100, you have to create a roster of those employees. You then have to know whether or not those employees are vaccinated or unvaccinated. You got to have it documented. And then if they are vaccinated, you have to have a copy of the vaccine card. So you can have a copy of the vaccine card. You can have a copy of some record from, a pharmacy where they got vaccinated or their doctor's office. Or if they've lost their vaccine card, you can use a special form that, they confirm that they're vaccinated, but it's under penalty of perjury and comes with criminal penalties if they lie. But you have to document their vaccination status and you have to record it and you have to have a copy. And if OHSA shows up to audit you, you have to be able to produce this roster within 4 hours. So why do I say that's the most important thing to do? Well, knowing how many of your current employees are already vaccinated or unvaccinated may very much help you decide whether you want to go with option 1, a vaccine mandate policy, or whether it makes more sense for your workforce to go with option 2, which is vaccination or weekly testing and masking. And again, it's your choice, but it's going to take time to put any of those policies in place. So there are a couple of key deadlines that we want to talk about. So this is going to be a little confusing, so listen to me. Under the ETS, the current deadlines say you have to do your weekly testing or you have to have everybody fully vaccinated by January 4th. That's what we call deadline 2. You've got to do that by January 4th. Now, everything else I talked about, the policy, the roster, the training, all of that, you have to do by December 4th. That's deadline 1. But listen to me, those are the deadlines under the ETS. Number 1, those deadlines might get delayed and stayed by the courts. But more importantly, we're all in South Carolina. So I'm only going to talk about South Carolina here. In South Carolina, we have state OHSA plans. That means that South Carolina, we have our own OHSA department. We have our own set of rules here. OHSA has 30 days in South Carolina to adopt the federal rules. So all of the deadlines, deadline 1 and deadline 2, whatever they end up being, will be delayed at least 30 days in South Carolina because South Carolina OHSA has to adopt them. So the very earliest someone in South Carolina is going to have to comply would be January 4th for everything else, February 4th for the vaccines or the testing. And that's assuming that the court challenges don't cause an additional delay. So when you hear the deadlines in the news, they're not really correct for South Carolina because again, in South Carolina, because we're a state OHSA state, we get a little bit more leeway. So now another question that people ask me all the time is how long is this thing going to last? Well, all ETSs only last 6 months, so probably just until May. However, part of what OHSA has done is they've already started the process to make this a permanent rule under OHSA. So if you think this rule is the greatest thing since sliced bread and you want OHSA to push ahead, There's a way you can make comments on the OHSA website. They'd love to have them. If you think that this thing is horrible and you do not want to see it become a rule, the comment period is open. That comment period is open through December 5th. So you have that as an option for how to comment and have your voice be heard. So once you decide what you're going to do, it's also important to calculate which people are covered. So remember, we counted to 100 to decide if you're covered. When you count to 100, you have to include your remote workers, anybody else that's working. But then when you get to question 2, which is which of my employees are covered, not my company, my employees, there's some really important exclusions. So again, if somebody is covered by one of the other ETSs that are out there, so let's say you've got some federal contracts and they're covered under that one, these rules don't apply. You're under the federal contract rule. If you have employees who are 100% remote, they are not covered by the rules. They count for how you get to 100, but you don't have to cover them in the rules themselves. If you have an employee that works exclusively outdoors, they are not covered by the rules. That one gets a little tricky. So what does exclusively outdoors mean? In the OHSA FAQs, they told us if somebody just kind of goes to the bathroom every now and then, and that's the only time they go inside, they count as exclusively outdoors. But let's say you have a grounds crew and they all meet somewhere in the morning, or a construction crew, and they all meet somewhere and get in the same work truck together and ride to a location, not exclusively outdoors anymore. Being in the work truck together will mean they're covered. You're also excluded if you go to a workplace where you're not around either customers or other employees. So think about a truck driver who just goes and picks up his load, gets in his truck, and drops off his load at a distribution center and never interacts with anybody. He's not covered either. So we do have some pretty big exclusions, especially that remote worker one, where those people won't have to do the other things in the ETS, get vaccinated, wear a mask, do the testing, any of that. So one of the things, and probably the biggest number one question is, if you decide to go the vaccination route, we're talking about all the normal rules with a vaccine mandate. Again, you got to have a religious accommodation form. You got to have a disability accommodation form. You got to process all of those accommodations. You've got to track and keep up with who's vaccinated and keep a copy of their vaccine forms. You got to give them a 4-hour leave to go get vaccinated if they're not yet vaccinated. But I think the real question people are asking is, what about testing? If I decide to go option 2 with testing, how does that work? Especially with workers who are highly unvaccinated, and employers are scared they're going to lose their employees in a tight labor market. They're really worried about putting a vaccine mandate in. So they're looking at this testing. So the number one question is, who has to pay for the testing? Number one question that everybody is asking. So the ETS says that you can make the employee pay for the testing as long as that is compliant with other rules that are out there. So what are the other rules that are out there that we have to look at? So in South Carolina, we currently do not have any other rules that would impact this. If you're in another state, you might though. So there are 30 states that have special rules on medical screenings. There are other states that have stringent rules on business reimbursements that would cover this testing. So it really depends on how you do the testing and how you enforce the testing. So let's assume you tell everybody you have to come into work on whatever day you pick with a negative test, and I need you to go to the pharmacy down the street and get your test and show up with it. You don't have to pay for that. That's on them. They've had the option to choose vaccination. They have not done so. So that's going to be on those employees, as long as it doesn't take them below the minimum wage. You got to make sure people don't ever go below the minimum wage. Now, if you say to employees, I want you to go down to your local pharmacy and get tested, but I don't want it to interrupt my work schedule. And so I'm going to say you have to go on your off day on Saturday and get tested. Now you have to pay for it because you've mandated that they do something outside of their normal work. And so now the testing is on you. You also have to pay for it if they're doing the testing at the work site under your direction. So then you'd have to pay for it in that kind of situation also. So why would you do that? Why would you have people come and test at your work site? Well, the main reason is control. So remember how you had to get proof of vaccination? You also have to keep records and have proof of the weekly testing. So you have to have either a report from your local pharmacy that the person's negative, or from the hospital that they're negative. You can use any kind of test that is lab monitored. You can use any kind of test that's FDA approved. You can't use the test that is a serology test. They have to be an approved test that we use. It has to be one of the antigen tests. It can't be serology or the antibody test. It can be the home test though, but the home tests have to be monitored. So there are a couple of kinds of home tests you can use. So one kind is somebody, spits in a bottle and they mail it off, and then they get an email with a negative result. That would be okay for your folks to use. The other kind is a rapid test where you spit in the bottle and you literally get the results in 15 minutes. But that test has to be proctored either by a telehealth person or by somebody from your company. So lots of employers are thinking through, is it possible for me to do the 15-minute test and do it after everybody gets to work, and we monitor it, and then we automatically have the results and we automatically have it there. Lots of employers are thinking through whether or not that is a reasonable option for them. But again, one of the big practical problems with the weekly testing is keeping up with the negative test results for every employee every week so that they're available to OHSA and they're readily available within 4 hours if OHSA shows up and wants them. So it's a lot of tracking and a lot of figuring out how you're going to get your people tested every week. Again, if you do it at the work site, you have to pay for it. If you send them on an off shift, you have to pay for it. If you just say, hey, you guys show up, you don't have to pay for it. So again, anybody who's working full-time has to test once a week. If you have people that only come in sporadically, they really are remote workers, just show up once or twice every now and then, those folks you only have to test when they're going to come into the workplace so that they have a negative test before they enter the workplace themselves. All right, I'm going to take a breath and see if we have any questions yet, Jason. I know I'm covering a lot fast, guys.
No, we do have one question here, and I think it's a really good one. If someone works remote daily, but travels and meets with people as part of her job, is that person considered remote?
So that person would count towards the 100. If they go and meet with anybody regularly, which is I think what you're saying, they would be covered, but you wouldn't have to test them weekly unless they met with people weekly. So if they only met with people, say once a month, you could only test them right before they went to meet with that person once a month. But when I say remote is excluded, you got to be 100% remote, like never, ever show up to the office, ever. You're truly a remote worker. That's the only way you're excluded. Otherwise, for your people who are mostly remote, you go to less than weekly testing, which is testing, basically get a negative test result before you go see somebody.
Yeah, so this sounds a little bit like it might be, a salesperson or something. They're never actually in the office, but they're traveling around to see people all the time. Or, you're a professional accountant or something like that, and you're going around to clients, but you don't actually have an office. That's what it sounded like to me. So
that's right. So in those cases, you could test those folks less than weekly unless they meet with people on a regular basis, and then you are going to have to test them weekly. So the other things to remember when I was talking about your testing is don't forget it's not just testing, it's testing and wearing a face mask. And we certainly know that there is a large portion of the population who hates wearing face masks. That is part of this. So it's testing and face masking. You can, of course, make your employees in South Carolina pay for a face mask, but it's both things, not just one or the other. You've got to do both. So it's testing and face masking, and we're certainly going to have a chunk of the population that is not gonna really like that either.
So someone else said, are you going to cover medical exemptions for weekly testing, such as a doctor's certification that their patient has antibodies and does not need weekly testing. Are they
Okay.
exempt?
So let's talk about that. So I think it depends on what kinds of antibodies you're talking about. So if somebody had COVID-19 and they're in a 90-day window of having COVID-19, they don't have to weekly test. On the other hand, if you have somebody that had COVID last year and they still have antibodies, lots of times people call that natural immunity when you see it come through. The ETS says, nope, that's not enough. You only have a 90-day window after you have COVID to be covered. Now, I will say what you could have happen is somebody try and make a medical accommodation request based on that reason, either under the vaccine policy or the testing policy. But the ETS specifically says that you should only give a medical accommodation. Basically, if somebody has an allergy or a couple of really limited things, and they have to have a doctor sign off that says that they cannot take this specific vaccine and the contraindications that Pfizer put out. Anything outside of that, the ETS says, nope, it doesn't count. So under those rules, under the medical ones, the natural immunity argument is not going to work unless the person had COVID within 90 days.
Okay. Those are all the questions we have so far.
Yeah, y'all are a quiet group. I may be going too fast for everybody. So the other things you need to know is if you have any kind of unionized workforce, you're going to have to bargain with them. We're seeing a lot of litigation over that with the other ETSs, and all of that is going to continue with this one. But the big thing I think everybody should realize is when you start thinking about everything you have to do, it's a lot. So again, the first thing you need to do is figure out what your workforce looks like. How vaccinated are they? We've got some employers who right now who are kind of deciding, hey, I'm just going to ask the question. I'm not going to collect the actual proof of vaccination yet. Nothing wrong with doing that at this point. Again, current deadlines will be coming, but I think they're going to change. My practical problem with that for you guys is you're just going to have to go back and ask everybody twice. So do you want to have to go through the process of asking twice or asking once? But once you get that, you got to keep a record, got to make sure the records are secure. Unless you're a healthcare provider, you're not covered by HIPAA, but all of these documents that you're collecting are confidential medical information, and you have an obligation to protect them as such. So you got to protect them the same way you do, say, your workers' comp records. You got to make sure they're protected if they're electronic or in paper form. You got to keep this confidential for everybody. The other thing that you have to be able to do by the first deadline, whenever that ends up being, is your employees have a right to ask you what the vaccination status of your workforce looks like. Now, that doesn't mean they get to say, is Jason Zacher vaccinated? And you don't get to say whether or not Jason's vaccinated. But what that does mean is that Jason gets to ask the chamber, what is the percentage of vaccination in this workforce where I work? So you have to be able to give the employees that answer according to the ETS. So that's kind of where that roster comes into place also. You got to have that thing in good shape, and it helps you make the decisions on what to do next. For those of you who are thinking, okay, I'm going to mandate a vaccine, let's watch some state laws to see if that continues to be allowed. If the ETS passes, any state law would be preempted. So the ETS would rule if the ETS survives all of the challenges. But here's what I'll tell you about a vaccine mandate. On one hand, it's infinitely easier because you only have to collect the cards once. You only have to store one set of records. But do not underestimate the number of accommodation requests that you are going to get, or how long and how timely that process is going to be, or how angry your workforce may be over a vaccine mandate. So loosely, and these are kind of my numbers after having done thousands of these in the last month, for white collar workforces, we are normally seeing roughly like 4 to 6% of your employee population ask for an exemption under a medical or religious reason. For blue collar workforces, that number jumps up to between 8 and 12%. So for somebody with a large number of employees, you could literally get hundreds of requests. We've got clients that have thousands of requests that they're working through, and to whether or not they can accommodate people through some alternative. If someone makes an accommodation request and your accommodation that you give them is okay, now you get to weekly test, you now have to pay for that weekly test. It's just like if somebody came to you and said, okay, I have a bad back, and your accommodation was to buy them and you to say, well, you can have a different chair at work. They don't have to buy that chair. The employer has to buy the chair. So those are the real practical things to think about with the vaccination. With the weekly testing, figuring out how you're going to make people test. Does the decision you make on how people test, what does that impact to whether or not you have to pay for the test or not, and the time it takes to pay the test. So again, if you make them do it on a day off, you're going to have to pay. If you do it at work, you've got to pay. How does that impact you? Also, how are you going to practically keep up with these weekly records? How are you going to do it? If you have 200 employees, they're testing every week and bringing you forms every week, how are you going to keep up with that? Because the ETS says if they don't comply with that, they can't come in your building. And I will say we have great services here in South Carolina, but we are literally talking about hundreds of millions of people having to do weekly testing. Everybody in this country cannot go down to their local health department on a Friday and get their nose swabbed and think we're all going to have the test back by Monday morning for everybody to go back to work. It's just not practical. And then I think one of the big things for people to think about, especially here in the upstate, is your industry and how the ETS is going to impact both your retention of employees as well as your ability to recruit employees. Because depending on your industry, it could be a really different answer. So let's say you've got two similar industries right down the road from each other, right? One industry says, we're going to let you weekly test, and we're going to wear masks, and we're going to pay for those tests, and you can do them when you walk in the door, because we're going to make this as easy as peasy pie for you. Versus the employer down the street who makes a different decision. That may be very impactful. Or you may have an employee who says, this is what we're going to do. And then you've got to factor in how many employees you may lose. And in this very, very tight job market, you've got to be prepared for that impact also. So this has really deep impacts on our workforce if the ETS arrives. I've done a lot of talking, Jason. We got any questions? You're on mute, Jason.
Yep, we do have another. Do you have a sense of what option vaccine mandate versus testing that South Carolina companies are leaning?
That totally depends on what industry you're in. And I think it also depends on your size and whether you're only in South Carolina. So there are a lot of multi-state employers that are trying to do a one-size-fits-all across the country. They're making one decision. I think our white collar is making one decision. Most of our white collars, I would say, are going towards vaccine mandates because they already have a highly vaccinated population. Yeah. Some of our other more manufacturing, more kind of blue collar workers, restaurants, industry, those kinds of folks, they're really, really struggling. And I don't think as a whole they've made a decision yet because they cannot figure out the practical aspects of the weekly testing and all that's involved there. They don't have the staff. You don't have extra HR people just sitting around to swab everybody's noses when they walk in every day. You know what I mean? And to keep up with the testing and the tracking, that feels very, very overwhelming to them at the moment. But at the same time, there is significant concern over the loss of workforce in the tight job market. So I think it really depends on your industry and where you're located and what your job market looks like. And I also think some of this depends on where you are. You know, I'm from a little one stoplight town from a little small county south of Columbia. There's not a lot of employers there. but there's a health department there. It's
Yeah.
pretty easy to go get a test at that health department and get your results back pretty quickly versus a more populated area where you're just going to have more demand. So I think that question is still really all over the place, and we don't really know. And I'll tell you, clients are doing all combinations of this. The other thing I'll say is don't forget, and this is going to make some people just go crazy, but the ETS is just the floor. You can always do more. So if you already have a policy in place that has pieces of this, look at it and see what you have to do to tweak it. Really, the only thing that I think people are doing is we do have some folks who are already testing more than once a week, especially in some retail, in some kind of that hospitality industry. They're already testing more than once a week. So they're already doing more than this, and they only have to kind of add a couple of pieces, their rosters, that kind of stuff to be compliant. It's just a floor, not a ceiling.
One thing we have not gotten into yet are the penalties, $14,000 per violation. Can you fill us in on what that is and exactly, man, if you had 10 employees, does that mean $140,000 of a violation on that front?
Yeah, so it's actually worse than that, Jason. So they really put some teeth into this thing. So they have really made it so just saying, forget about it, I'll just take my penalty, it is not a viable option. So it's roughly $14,000 per penalty. If you have a willful violation, which means you just don't do anything, that can actually be times 10, which could be 140 per penalty. And then if you get a warning and you still decide to ignore it, that penalty becomes per day. And we're still waiting to see if per penalty means like per company or per employee. So you could be looking at $14,000 times however many employees you have. So this thing has real teeth if it survives. Now, look, the legal challenges to this are real. It is a legal hurdle. When we talk about ETSs, they've only tried to have 10 in the history of OHSA. 7 of those were challenged, and of those, only 2 or 3 survived. So there is a significant and very real legal challenge to this as to whether or not it's going to survive. I will also tell you the thing is 490 pages long. They spent the first 253 writing the world's longest legal brief, explaining why they have both the legal authority, the medical backup, how we're going to have enough tests available. They've already addressed every issue that anybody could think of in the ETS to try their best to keep it enforceable. I mean, OHSA has given it a yeoman's chance of survival, but again, it's an uphill battle when we're talking about an ETS. But I will also say this. So a million years ago, they tried to have an asbestos ETS. The ETS was struck down, but they were still able to make the asbestos rule final by going through the longer rulemaking process. Part of this is the emergency nature of it, but it doesn't mean they're not going to try and make it a full rule. And again, they've already started that process also. So good times for everybody.
No, well, it's going to be a good time. And I think, as you saw the headline this afternoon, that there's going to be a South Carolina law implemented or introduced, at least, that would say that these things are illegal in South Carolina, whether you cannot ask someone's vaccine status, et cetera. And I have not read the full bill yet that they're planning on filing. My question to you would be, and this may be, you may punt on this, but what is, when you've got a lot of companies here that are going to be caught between state laws, wherever those are, or you're in a multi-jurisdictional company where you're in California, Texas, South Carolina, and New York, and you got 2 states that say you have to do it and 2 states that say you can't. What is a business to do with all this, with this mishmash of different rules and laws?
Yeah, it's really, really difficult right now. One thing I would say is that all laws have an effective date. Knowing who's vaccinated and who isn't is really critical to making your other decisions. So maybe think about doing that quickly, because that's really critical. When you have other laws, and there's 1.5 states right now where you're not allowed to ask vaccination status, Montana, and then there's a bill pending in Tennessee. It's sitting on the governor's desk right now, where you can't ask. So let's assume South Carolina law passes a rule that says you can't ask. Usually those rules say you can ask, but you can't require an answer. You consider those people unvaccinated. So they fall into the unvaccinated category. So whatever you do with the unvaccinated, you assume that they're not vaccinated if they do not voluntarily give an answer. But it's very difficult. But again, at the end of the day, if the ETS survives, then there will be preemption, and the ETS will essentially eat all of these state laws, and the state laws won't matter anymore. Yeah. But it's the interim where it's going to be very difficult for companies to try and comply with the ETS and get prepared for the ETS and do the things that they want to do to get prepared for it and comply with state law at the same time. You're not going to want to jump ahead and violate state law until and unless the ETS passes and goes into effect and all of that kind of stuff.
Yeah.
So it's a balancing act.
Any other questions from anyone? You can drop them in the chat real quick. I think that you have answered almost all of my questions on this. Obviously, this is going to be a major mess for the next several weeks for a lot of businesses, but I think that was very good advice on getting started now. And again, as I mentioned at the beginning, this is not a webinar about the legality of it, but really what you need to do to comply if and when this does become law. And that's an important thing to our regulation, which is important for everyone to understand. So if there are any other questions, if you want to throw them in the chat really fast, we have another few minutes. Any suggestions on where to get a sample policy? There's a good question for you.
Kelly, you're welcome to email me after this is over at ashley.cuttino@Ogletree. We have template policies depending on where you're located and what you do, and I can talk to you about this.
And we just dropped in the chat also, if you are a chamber member, Scalpel Solutions is offering discounted testing, and you can use those for your employees and offer that up to your employees too. Whether they are whether you're following the ETS or not, it might be a good idea for folks throughout your company. So we do offer that with Scalpel Solutions. You can go take a look at that again. It is in the chat, greenvillechamber.org/laboratory testing. So if there's no other questions, I want to thank everyone for attending today. Ashley, thank you so much for your time. We appreciate you coming back and back to this and helping us out, because it is wonderful. And this is such an important issue. I think probably one of the bigger business regulations that hits everybody that we've seen in a very long time, or nearly everybody. And so I appreciate your time. Recording of this will be shared on the Greenville Chamber's website and sent to the attendees, along with a survey. And the survey is important for creating content for future Community Matters webinars, so please share your feedback. Thank you all very much. Have a great week. Ashley, thank you again, and we look forward to seeing everyone at the next Community Matters.
All right, good to see everybody.
Bye-bye.